All right, so today we're talking about some new updated guidelines on gonorrhea treatment. ACOG dropped this back in November of 2015. This is not totally new, but they're recommending dual therapy all the time for gonorrhea, or even if the nucleic acid amplification test was negative. So you're going to give ceftriaxone 250 milligrams IM plus azithromycin 1 gram orally. They're recommending direct supervision for that, but I guess that depends on your patient population and how feasible that is with your office setup. In my practice, we don't really usually necessarily supervise the patient. So there's a couple of other second line options that you can use, but I really want to talk about when the patients are penicillin allergic. I'm not talking about the fake allergy. We're talking about severe IgE mediated beta-lactam allergy. You're going to give them gemifloxacin 320 milligrams orally or gentamicin 240 milligrams IM plus azithromycin 2 grams. Once again, this is second line penicillin allergy. You're going to up the azithro dose to 2 grams and use either the gemifloxacin or the gentamicin. If your patient is pregnant and she has a penicillin allergy, you're going to do the gentamicin 240 milligrams IM plus the azithro 2 grams, or ride solo just with the azithromycin 2 grams. Really important. You got to check a test of cure. If it doesn't work, she needs to see infectious disease. All right, so let's summarize this test of cure business. If you use the first line therapy, you don't need a test of cure. If you're using something second line, make sure you check the test of cure in 7 to 14 days. If the test of cure comes back positive and the patient with absolute certainty has not had intercourse and you've ruled out reinfection, you need to get a sample over to the CDC for the antimicrobial susceptibility testing. Now, I like to tell my teens that they can't have sex for a month, but the real answer is no sex until 7 days after both of the partners have been treated. If it's legal in your state, offer expedited partner therapy. That's only going to decrease the spread of this STD. And I will put information on how you're going to get in contact with the CDC if you need to in the description box. If you're needing to send a sample to the CDC, you definitely want to get your local infectious disease specialist involved. If you like my videos and like what you see, go ahead and hit the subscribe button. April is STD Awareness Month. Recent data from the CDC shows chlamydia, gonorrhea, and syphilis are on the rise for the first time since 2006. So remember to talk, test, and treat.